What medications are normally given to women with PCOS? Polycystic ovarian syndrome is a condition of approximately 5 to 10% of women of childbearing age. Diagnosis can be difficult because the signs and symptoms can be subtle and varied. This may include hirsutism, infertility, menstrual irregularity, and biochemical abnormalities, most notably insulin resistance. So treatment should be targeted to a specific manifestation and individualized patient goals. When choosing a treatment regimen, physicians must take into account comorbidities and the patient's desire for pregnancy. Lifestyle modifications should be used in addition to medical management or treatments for optimal results. Few agents have been approved by the US Food and Drug Administration, specifically for use in polycystic ovarian syndrome, and several agents are contraindicated in pregnancy. Insulin sensitizing agents are indicated for most women with polycystic ovarian syndrome because they have positive effects on insulin resistance, menstrual irregularities, and ovulation, hirsutism, and obesity. Metformin has the most data supporting its effectiveness. Rosiglitazone and pioglitazone are another agents which are effective in ameliorating hirsutism and insulin resistance. Metformin and Clomiphene alone or in combination are the first-line agents for ovulation induction. Insulin sensitizing agents, oral contraceptives, spironolactone, and topical Eflornithine can be used in patients with hirsutism. Polycystic ovarian treatment focuses on managing and not reversing your individual concerns such as infertility, hirsutism, acne, or obesity. Specific treatment might involve lifestyle changes or medications to regulate your menstrual cycle. Your doctor might recommend a combination of birth control pills. Combined birth control pills that contain estrogen, progesterone, decrease androgen production, and regulate your estrogen. Regulating your hormones can lower the risk of endometrial cancer and correct abnormal bleeding, excessive hair growth, and acne. Instead of pills, you might use a skin patch or a vaginal ring that contains a combination of estrogen and progestin. Progestin therapy. Progestin therapy, taking progestin for 10 to 14 days, 1 out of every 2 months, can regulate your periods and protect against endometrial cancer. Progestin therapy doesn't improve androgen level and won't prevent pregnancy. The progestin's only mini pill or progestin containing intrauterine device is a better choice if you also wish to avoid pregnancy. To help you ovulate, your doctor might recommend Clomiphene citrate. This oral anti-estrogen medication is taken during the first part of your menstrual cycle. Letrozole or Femara, this is a breast cancer treatment medication that can work to stimulate the ovaries. Metformin, Glucophage, Fortamet, others. This oral medication for type 2 diabetes improves insulin resistance and lowers insulin level. If you don't want to become pregnant using Clomiphene, your doctor might recommend adding metformin. If you have prediabetes, metformin can also slow the progression to type 2 diabetes and help with weight loss. Gonadotropins. These hormone medications are given by injection. These reduce excessive hair growth. Your doctor might also recommend birth control pills. These pills decrease androgen production and can cause excessive hair growth. Spironolactone or Aldactone, this medication blocks the effects of androgen on the skin. Spironolactone can cause birth defects, so effective contraception is required while taking this medication. It is recommended if you are pregnant or you are planning to become pregnant. Eflornithine or Vaniqa, this cream can slow facial hair growth in women. Electrolysis, this is a tiny needle which is inserted into each hair follicle. This emits a pulse of electric current to damage and eventually destroy your follicles. You might need multiple treatments. So this in short is recommend treatment plans that a conventional physician might offer for polycystic ovarian syndrome. But remember, these are all effective in just managing your symptoms and not reversing your condition. So lifestyle modification is actually the cornerstone and the key to reversing your polycystic ovarian syndrome. I hope this video helped.